Cascadian Photog. It's just Claudio this time. I am here with a local emergency room doctor. We're going to just call him Dr. Antifa today. We're going to do training for catastrophic bleeding, gunshot wounds. I know a lot of people have been really concerned about that since what happened in Kenosha was really sad. One of our streamers from Portland had to intervene in that situation, and it made a lot of people concerned that maybe if there wasn't a medic around or if something really bad happened and there weren't enough medics around, that they would have to do something that they didn't know how to do. So we're going to talk about what you would need to do in that situation, and also how to use a tourniquet on the fly and when to use a tourniquet. So let's talk about gunshot wounds.
Okay.
What should we do when we have catastrophic bleeding?
By far and away, the most important thing you need to do is to try to stop bleeding. That's what's going to kill somebody of a gunshot wound is blood loss. And I wouldn't waste a ton of time working on this. I would concentrate on getting them to a paramedic or somebody that can get them to a trauma center really fast is certainly your first priority. But if you're really stuck in a situation where you need to do something right now, then yes, absolutely dive in and help. And stopping bleeding is your number one priority in that situation. And by far and away, the most effective thing you can do is direct pressure. And a great amount of pressure over a small area where the bleeding is coming from will do a lot more good than putting a broad amount of pressure over an area if you can help it. So you can imagine if you had a garden hose that was turned on, but it was capped on the end, so there was high pressure in the hose, and you put an ice pick in it and it was bleeding, you would stop that water flow much more effectively if you put your finger or thumb right on that spot with a high amount of pressure than if you put your hands over it.
Okay.
It would
because it would spray around your hands, right?
Exactly. You want to put the most amount of pressure per square inch that you can, and if you can mash on that with your finger, and it's going to hurt, but that's okay, you're going to potentially save somebody's life. So small amount of pressure right over the bleeding source if you can.
Okay. So how hard do I do it? Will you show me on my arm?
Mm-hmm. So I think if you can kind of feel your own pulse in there, and you can kind of get a sense of what that pressure is like in there, you gotta push pretty hard to stop that pressure. And if you want to do a little experiment on yourself, in your wrist there's an artery here, just on the inside of the bone, towards the midline from the bone, and another one to the midline of this bone. So this is the radius on your thumb side and the ulna on this side. If you compress both of those arteries really hard, and then make a fist, okay, let your fist
Here,
go.
let's show this for the camera. Let's get a little closer.
And if you let your fist go, it's going to be white. You know you've stopped the bleeding, and then if you let one go, the hand turns pink again. So that's a good little test that you can do to kind of judge how hard do I have to push to stop arterial bleeding.
How would I know that on BIPOC colored skin?
It would be harder for sure, but you can still, even on somebody who is a darkly pigmented person, you should still see a color change.
Okay. So just very important for a Black Lives Matter protest that we know how to do this on differently.
Yeah, and that's just a demonstration, but don't worry about pushing too hard. If you're trying to stop bleeding, just push hard.
Yeah, because we've all seen in action movies when people like put their thumbs in bullet holes and they're like screaming in pain, and we don't want to put people in more pain, but this is going to save their life, right?
Mm-hmm.
So that was hard enough that it does leave nail in beds. But obviously we're trying to save somebody's life. So even though it's uncomfortable to hurt somebody and they might say that we're hurting them, we have to do what we have to do in that situation, right? So what would I do for somebody this is a scary question, but what would I do for somebody that was shot in the chest, shot in the stomach?
It's a really difficult situation, and unfortunately a fairly desperate one as well. The best you could do is, if they're pouring out blood, try to see where the blood is coming from, and you're gonna just have to take probably the heel of your hand and just mash on that wound the best you you can do.
So that wouldn't be a situation where we would use our thumb. That'd be a situation where we would use our whole hand.
Chances are you're not going to know where that bleeding's coming from. On an arm or a leg, you could probably see a pinpoint spot where the blood is coming out from, and put really directed pressure on that spot. On a torso wound, chest or abdomen, you're not going to know where it is, and it's probably going to be from multiple vessels. So you're going to have to use, something broad and push really hard.
Okay. Do I ever do CPR on somebody that's had a gunshot wound?
It's a good question, and it's somewhat controversial, and there are national organizations that have come down on both sides of this. I can put it this way: if you have somebody that has zero pulse, there's no signs of life at all, you're never going to hurt them by doing CPR. But for a young, healthy person, if they have no pulse because they've lost so much blood, doing CPR is futile, in my opinion. I think you're not likely going to help them. And if you were, God forbid, in a multi-casualty accident and you had other gunshot victims and you had somebody with a big chest wound and had no pulse, then I think your efforts would be better spent on another person.
Okay. That's a hard one to take, but I think it's important to remember that we need to split our priorities if we were ever in that horrific of a situation. So there's been a lot of talk about tourniquets, particularly with limbs. And lots of people are saying you shouldn't use a tourniquet on somebody unless they're like dying, or the tourniquets do more harm than good. I've heard lots of people say both of those statements.
Unfortunately, both are true.
Both are true. Okay, alrighty. So how do I know when to use one?
Yeah. Good question, and this takes some judgment, and it's difficult for somebody who's not medically trained or sophisticated in some way. So it is difficult. I'd say the first thing you should do is that if it looks like it is venous blood, and venous blood will be blood from veins, is darker and usually non-pulsatile, and it can still flow at a pretty good rate.
What does pulsatile mean?
Pulsatile means that's spurting.
Oh, okay.
So that's coming from an artery. It's so that's high pressure blood on the side of the circulation where the heart is, and the heart is squeezing that blood out, and it'll squirt. And it'll usually be really bright red, and blood from veins is slower, it's low pressure and darker red.
Okay, so that's what most of us have seen.
Yes,
okay.
Exactly.
Most of us have not seen spurting blood.
Yeah, and we all get hurt sometimes. We have cuts, scratches, things like that. That'll be venous bleeding.
Okay, alrighty.
And you should be able to stop that just with direct pressure like we're doing. And not high pressure. You're not having to stop an artery from bleeding. Veins have very little pressure in them, and just a light amount of pressure should be able to stop venous bleeding without any difficulty. So I'd say by far and away, if you can stop bleeding with direct pressure, do that first.
Okay.
If you can't stop it with direct pressure, if it's still bleeding a lot,
if you're seeing that pulse,
you're seeing the pulsatile flow, or say it was really a massive wound, if somebody shot you in the arm and really blew your arm apart, that's going to be hard to stop with direct pressure. And so putting a tourniquet above that wound would be an important way to stop that bleeding.
So I know Cascadian Photog does not carry a tourniquet. As journalists, we are not prepared to do that, but as we saw in Kenosha, sometimes journalists get called to do things outside of our realm, and we have to do things to help people. So what can we do if we're stuck in a situation where we're seeing that happen and we need to intervene right now?
There are a couple things you could do. So one thing, particularly with extremity injuries, and of course we're only talking about extremities, you can't put a tourniquet on somebody's. Right. Sure. So one thing you could just do is just take your hands and just wrap super tightly above it. Okay. And if you want to learn this, you can certainly take a look at YouTube videos or something online, find where the arteries are. Like in the arm, it runs in this groove right here between the bicep and the tricep. And if you can really wrap your hands around and dig your fingers into that groove between the bicep and the tricep, you can shut off the artery. So I'd say your hands by far and away are your best tool.
And you probably wouldn't damage anything if you were wrong about a tourniquet. It probably wouldn't cut things off quite as much, yeah?
No, you.
I'm wrong.
You're going to shut off flow in that entire arm.
Okay.
But the body can take that
Okay.
for a period of time. And if they're really bleeding a lot, you've got to do it.
Okay.
So, like a lot of things in medicine, there are treatments that have harm associated with them, but what you hope is that the benefits outweigh the harm.
Okay.
And in this situation, it's one of them. So if
Okay.
somebody has really tremendous bleeding, you can't stop it with direct pressure, then a tourniquet bit, whether it be with your hands or with some kind of device, yes, it can cause some harm, but the benefit will hopefully exceed that harm.
Okay. So if I have baby hands, which I do, and there is a larger person that there's no way.
Mm-hmm.
What can I make out of something I have?
Yeah, so there's a couple things you can do. One of the most common tourniquets, and you can buy commercially available tourniquets if you want to carry one around in
Our
a bag.
medics do have them. So if our medics are there, far and away let them do this.
And they're great devices, and if you have one, I would definitely go with that. But you can use something like a length of rope, or you can use just a bandana. I think a lot of people.
Oh, everybody has a bandana right now.
Everybody has a bandana, so you can just kind of do this Cub Scout style and make it into kind of a rope, and you could tie it around the limb. I'm going to do it a little lower, and then you can put a tie in it, pull it pretty tight, and you can take whatever firm object you have. You know, it's a little piece of wood. You could use.
Can you use like a Sharpie?
You could probably use a Sharpie. Yeah, I think you could.
Because everybody has this because the NLG number. Everybody has a Sharpie.
Okay. And then you would take whatever that object is, put it on top of your knot, and tie another knot, and just one half hitch should be fine. Thank you. And then you twist it. And then you can create a lot of pressure.
Oh yeah, that's a lot of torque.
With this. And that works very well. If you have a long enough piece of material, once you twist it, you can use these ties to tie it in place so it doesn't unravel.
Gotcha. But otherwise, you would just hold it until you had more experienced medical care there.
Exactly. And so you can use that on an arm or a leg. Somewhere up close to the top of the thigh can sometimes be hard to get a tourniquet around. And we all, the femoral artery, the main artery that goes into the leg, kind of runs underneath the crease that we all have between our torso and our thigh. If you go about halfway along that crease and 1 inch down, you'll feel your own pulse there.
Yeah.
And that's another pressure spot where you can block an artery. So if you take the heel of your hand and mash it into that
So if there was like a leg
artery.
bullet wound?
Mm-hmm. Yeah, in the upper thigh area, you could mash on that artery. That's called the femoral artery there. You could mash on that artery and help restrict blood flows to keep it from leaking out.
Okay. All right. There's been some talk about fancy things that you can buy, like Quick Clot, or like some of the folks in our movement that are veterans have used things like that before. Is that something that we should use, or is that something that's available?
My understanding is that you can buy them. They're very expensive. Some of those fancy products that are designed to stop clotting, they do work, but some of them also give off a lot of heat, and they can burn tissue.
Okay.
And so you do have to be careful with them. So I'd say if you're not trained to use them, it would certainly not be my highest priority. I think direct pressure, like we were talking about, is going to work the huge majority of the time. And if you're trained to use those kind of procoagulant things that make things clot, if you're trained to use them, it's fine. But the other thing I worry about in untrained hands, despite how well intended they might be, if you're depending on this chemical reaction to save the patient's life, my fear is that it may not work where direct pressure could have.
Sure. So there's something more simple that could potentially be more effective in the right hands.
Right.
Gotcha. Excellent. Is there anything else that you can think of that maybe a novice should know about a gunshot wound?
I think that's mainly it. Stop bleeding whenever possible. If somebody is unconscious but still has a pulse, try to make sure their airway is open. You can grab them by the back of the jaw and pull their chin up, or you can grab their chin and pull it up. You just basically want to keep that tongue from sagging in the back of their throat. It would be horrible to have some unconscious person, you successfully stop the bleeding, but they're not breathing. So pay attention to their breathing next. So stop the bleeding, look at their breathing, make sure that they're breathing the best you can, and just expend every effort possible to try to get them into trained hands as soon as you can.
Okay, excellent.
Someone has a question.
Okay.
Do we try to remove the bullet?
No. You're very likely to do more harm than good, unfortunately. So that's best done in an operating room, and sometimes the bullet can even be blocking the bleeding, and so if you pull the bullet out, it can sometimes make the bleeding worse. So yeah, definitely just stick to the direct pressure, and you definitely want a trauma surgeon to take care of that part of it.
Are there any more questions? It's an awkward time of day, so there definitely might not be. And I'd be happy to get questions answered when people view this later today. I can get more questions to Dr. Antifa, and we'll figure it out. Thank you guys so much for watching. We're going to go ahead and end the stream. Thank you very much. Let's see. Oh, we do have a couple more. What if somebody tells you they're on a blood thinner?
Same thing, basically. It's going to make it much more challenging to stop that bleeding, but in terms of the steps you would take, just the same.
Okay. What about abdominal wounds?
Same thing like we were talking about before. It's a really difficult situation, and your chances of helping that person are diminished in that situation, but I would just take the heels of your hands and push deeply into that wound and try to put pressure on the vessels that are bleeding. And you may have to push in multiple directions because the bullets cause a lot of trauma and will cause bleeding from both ends of the vessels. And so you may have to put pressure in multiple areas.
Gotcha. Okay. Anything else? All right. Thank you guys for joining us. Like I said, if you have questions that come up later, I am more than happy to cover them. Thank you for joining us. Jacob will be on later tonight for coverage. I am not on tonight. We will see you later. Bye-bye.